Hey future doctors, welcome back to our channel Teddy Guides You. Today we are going to discuss about episcleritis. Okay, it is a red eye imposter. So first important thing is definition. This episcleritis is a benign condition in which you will see recurrent inflammation. The name itself is saying itis means inflammation of episclera, involving Tannen's capsule but not the sclera. Sclera is not involving here. Only the Tannen's capsule is involving, and it is most common in young adults and 2x more in women. So comparative to men, women are most commonly affected. Now let's discuss about etiology here. The etiology can be remembered with a mnemonic I shit. I for idiopathic means unknown in many cases. S for systematic diseases like gout, rosacea, psoriasis and connective tissue disorders. H for hypersensitivity reactions like in TB and streptococcal toxins. And I for infections like herpes, syphilis, Lyme disease and tuberculosis. So these are the etiology of episcleritis. Now let's discuss about pathology. Here the important thing that you must remember is there is lymphocytic infiltration as it is inflammation. Inflammation is of two types like acute inflammation and chronic inflammation. In acute inflammation you will see neutrophil infiltration, whereas in chronic inflammation you will see lymphocytic or macrophages infiltration. Here there will be infiltration of lymphocytes in episcleral tissue, and you also see edema and congestion of Tannen's capsule and conjunctiva. Okay, so what are the clinical features? So clinical features are very important because when the patient comes to you, you must diagnose most of the cases by using only clinical features. So it can be remembered by red eye. Okay, R for redness, which is very common in majority of the eye infections. E for eye discomfort. D for dryness or mild photophobia can be seen here. And E for excess tearing. So these are the symptoms, whereas signs are like which a doctor will identify them. They are simple episcleritis in 75% of cases, which is sectorial or diffuse redness, and nodular. You can see simple or nodular. Okay, simple is simply the redness is diffuse, but whereas in nodular episcleritis you will see pink or purple nodule 2 to 3 centimeters from limbus. Okay, so for example, here you will see purple nodules 2 to 3 centimeters from the limbus. So it is nodular episcleritis. And so what about the clinical course here? Here it resolves in 10 to 3 weeks and recurrence is also very common. And here we can find a rare relapsing type, that is episcleritis periodica fungus. Okay, so what is the treatment that you are giving to your patient as a doctor here? So the treatment is 3C2N. C for cold compress. Cold compress, you can go for a cold compress or carboxymethyl cellulose or corticosteroid drops for severe cases, and you also give NSAIDs, but as it is mostly self-limiting, no treatment is needed in mild cases. So these are the important points that you must remember regarding episcleritis. Hope this video helpful. Consider subscribing to the channel Teddy Guides You for more interesting and short videos on important topics. This is Harshita signing off. Thank you so much.